road traffic accident in a bus, mass casualty incidence. This is a mass casualty incident. So there is a difference between mass casualty and multiple casualty, MCI. We called it as what we call MCI, multiple or mass casualty incidents. There is a number of patients outsurge the hospital limit. So we receive a baby in pediatric department on an emergency triage in an unresponsive state and bleeding from the limb, right limb. Yes, start.
So, patient was brought to us by the emergency healthcare worker from site of bus accident. So let's check for response first.
No response.
No response. So check peripheral pulse.
Yes, no peripheral pulses.
So keep trying. Try twice.
There is a bleeding coming from the right limb.
Right limb.
Right limb se bleed.
First of all, we have to stop the bleeding.
For IV access.
Fail. IV access, peripheral pulses are absent.
Please bring the dressing material.
Yes.
Control the bleeding. And
Compression.
There is a bleeding. Who is bleeding? Yes.
pressure band is applied. And
Who is on airway? Who is on vital? Who is doing primary survey?
Primary survey.
See, this is you will get.
Primary survey.
Yes, keep on doing. Yes, one maintain the airway.
Sir, what is the SpO2, sir?
SpO2 76.
Let's better intubate. Let's bring the intubation equipment.
Baby is having hemorrhagic infra or vital both sides.
Okay. So let's go for
Only the this
Peripheral pulses are absent.
two attempted failed.
Yes, two. Yes, very good.
For IV access, sir.
Peripheral pulses absent. Go for central pulse. Check at least. Very feeble. Very feeble. Yes.
I'm going
Yes.
for IV
we
access.
need IO
Yes.
access.
Put IO axis. Yes. Saturation still 82 even after ambo bag.
20 ml per kg. IV fluid started.
so there is no other injury.
Yes.
Only the
Who will do the manual inline stabilization of spine because there is a mass casualty incidence.
I
There
will
might
help
be
with
yes.
that.
Yes, very good. Which number tube you have used?
Number 3.
Number 3. Okay, fixing at
Fixing at 9, sir.
yes. Primary survey. Keep on doing abdomen, pelvis, everything. Abdomen, pelvis,
there is no other
neck distension. Neck distension. Just there is a poor response. Check once more. Right side it is coming more. Is it? Why? What is the problem? Tube has inserted so much. Now it is okay. Yes, very good. That's why you have to check at what level you have to fix it. Okay, yes. Saturation is 94 now. Okay, peripheral pulses still absent. Have you given the bolus?
Yes, sir.
How much?
400 ml.
Okay. Primary survey. Any findings in the chest?
no other findings.
Right
Chest is
side.
okay.
Right side poor air entry. Right side poor air entry is there.
Auscultate, percussion.
Percussion, sir.
Yes, percussions dull sound.
Use auscultate भी कर लो.
Diminished blood sound.
So
Case of
Yes.
hydronium.
Yes.
on the hydrothorax. Pneumothorax, sorry, pneumothorax.
Yes, fast. Have you checked the pelvis? There was a bleeding from right limb. Whether it has stopped. Have you checked for a tourniquet you have applied? Have you checked for peripheral pulses now? Radial is present.
Radial is present.
Yes. Baby is still unconscious. What are the reports? 5H5T. Find out the cause.
So hypovolemia can be, sir, one of the cause because the bleeding is there.
Yes, yes.
Hypokalemia
Yes.
or hyperkalemia should be evaluated.
Yes.
Then hypothermia because of bleeding, it can.
Yes, yes. Now peripheral pulses has come.
IV
Reports.
IV access now.
IV access secured.
Secured.
Okay, connect the maintenance fluid to IV access.
Connected. Removing the IV access.
IO access removed.
So next for the
Now BP is around 86/40 and saturation is 94 on mechanical ventilation. Okay, bleeding has stopped now. Now we have to go for further find out X-ray investigation, CT head,
Secondary assessment.
or some hospitals they will follow trauma protocol. In trauma protocol they will do CT head, 3D cervical spine, CT chest and abdomen. If there is a problem, any fractures, lower ribs and all, they will go for CT later on. Because CT chest hardly, CT complete this trauma protocol hardly takes few minutes, that's all. In our hospital we'll follow. Immediately trauma patient comes, like ultrasound taking there, X-ray getting. So we'll do immediate CT unconscious patient, CT head, cervical spine, chest end, in same sequence we'll do. Everything is ready. If fractures are there, we'll go for 3D CT. And if in patient is in shock, so we'll first resuscitate, then we'll find out the where exactly is the problem. Because hemothorax, pneumothorax, and this one IC bleed, intracranial fractures, and lower rib fractures, this will come to know in CT. Liver lacerations and all. Blood vessels pathology will get it in contrast CT scan. We have to get it in triple phase contrast CT scan. There we'll find out. It is a time consuming. Again, we don't know. Patient is in shock whether he or she is in AKI or not. Acute kidney injury, then contrast will be contraindicated. So this is how. Very good. Team has performed well.